Nikki Coburn, and today I'm going to be changing a CVAD wire and do it in a sterile procedure. So the first thing I'm going to do is review the order, make sure there are no discrepancies. Then I'm going to gather my supplies, go into the patient's room, identify them by two means, so for instance name and birthday, and check that against the wristband. And then once I've identified the patient, I'm going to explain the procedure to them, ask them if they have any allergies to the tape that I'll be using, and then I'm going to provide for privacy, make sure I have a trash can nearby. I'm going to go ahead and wash my hands, and then put on personal protective equipment if necessary. Then I'll go ahead and elevate the patient head of bed up, make sure they're comfortable, and put the side rail down that I'm working on. And then make sure the overbed table is nearby and close. And then I'll go ahead and put the patient's mask on so that they don't breathe onto the site. Okay, so the patient's mask is on, and then I'm going to go ahead and open my sterile field away from me, not to contaminate anything. Then I'll go ahead and reach in without reaching over my sterile field, just grab my mask, and this will not be sterile because I'm putting it on. Go ahead and put my mask on. I'll go ahead and get out my sterile glove pack since the outside of it won't be sterile. Make sure not to reach over my sterile field again. Go ahead and put on my clean gloves. And I'll make sure throughout the procedure I don't reach over or turn my back from my sterile field. Okay, so with my clean gloves on and both of our masks are on, I'll go ahead and assess through the old dressing the skin integrity, see if there's any drainage, blood, and note the type of CVAD that we're using, and this one seems to be tunneled. And then see if there's any redness, inflammation, or pain. And then the patency of the lumen. Okay, so then I'm going to stabilize the catheter with my non-dominant hand, and I'm going to peel the dressing around, and then I'm going to make sure that I pull the dressing up towards the insertion site so that I don't risk pulling out the lumen. And so I can let this go. I can go ahead and take off my old dressing, and with my clean gloves, I'll go ahead and wash my hands and then put on my sterile gloves so I can start my sterile procedure. I'll back up from my sterile field there. So now that I have them on, they're sterile, I can go ahead and adjust my fingers as necessary. Alright, once my sterile gloves are on and adjusted, this is sterile, so I can throw this away without dropping my hands below my waist. And then I've already assessed the site, and the patient's mask is on, so they can't breathe on it. I'm going to go ahead and reach into my sterile field. This is all sterile in here. And I'm going to use my 1 alcohol swab stick, and I'm going to just clean anything on and around the site. I can dispose of that. Okay, so with my non-dominant hand, I'm going to stabilize the catheter here. I'm just going to clean the hub of the CVAD wire and just clean any other drainage afterwards. Okay, so I can go ahead and dispose of that. And then this is my sterile hand. I can go ahead and grab the ChloraPrep, break the wings, and then stabilize this again. And you just want to apply friction for 30 seconds and try not to do any wiping motions towards the insertion site. So just do this for 30 seconds. And just move out away from the insertion site, at least 2 to 3 inches away to cover underneath the sterile dressing. And once it's been 30 seconds, you can dispose of this. Go ahead and get an alcohol wipe. And this way you can clean the lumen. Alright, so with this one, just stabilize this, and you can just do in one swipe, clean what's going to be underneath the dressing, and you can dispose of this. Then make sure everything is dried, and you can use your protective wipe on their skin. So you'll stabilize this, and make sure when you're drying everything, don't fan it, so that can introduce microorganisms into the site. Okay, so you can dispose of this, let everything dry naturally, and then once everything's dry, you can go ahead and reach in and get your transparent dressing. Open this away from you, dispose of that. And the main thing you want to do is make sure that through the old dressing you can see, or through this dressing, make sure that you can see the site where it's going through the skin, so that you can check for the skin integrity and make sure it's not red or inflamed. And then go ahead and put on the date, time, and initials, and note the gauge. And then you can go ahead and take off the white part to secure the dressing to their skin. Okay, so once that's on and it's secure to the patient, we can go ahead and take off my sterile gloves, take off my patient and my mask and the patient's mask, and dispose of these. I would go ahead and clean up my supplies, put the patient back in a comfortable, safe position. So just put the bed rails down, bed down, call light within reach, clean up my supplies, wash my hands, and report and record my findings.